A very good afternoon to all. I'm Dr. Ruthra Mohan from IIP Digital Media team. We are live on IIP India YouTube channel for this webinar on clinical practice guidelines and women's health need of the hour. This webinar is being organized by IIP and IIP Women's Cell Gujarat. The members in this session are panelists Dr. Megha Sheth, Dr. Heta Patel, Dr. Kushbu Thakkar, Dr. Deepali Hande, and Dr. Smita Joseph. The moderator for the session is Dr. Madhuri Kasi. Before we start, I would just like to tell you about the IAP digital team. So we are a group of physiotherapists who handle the Zoom platform, live streaming, and IAP social media. IAP has its profile in Facebook, Instagram, Twitter, LinkedIn, and YouTube. We request all to follow these any of these platforms to get regular update during our events, and also to get the recent updates about physiotherapy. You can subscribe to IIP YouTube channel so that you get regular notification during our live webinars. I'll be sharing the links for the social media in the chat shortly. So now I request Dr. Dhara to please take over.
Thank you so much, Dr. Uttara. And indeed, IAP Digital team is doing a wonderful job. Good afternoon, everyone. Good afternoon, panelist, moderator, Nehal ma'am, and all the participants on behalf of IAP and IAPWC Gujarat. I'm Dr. Dhara Sharma, President IAP Gujarat, and on behalf of entire IAP Gujarat team, I would want to welcome you today for this wonderful panel discussion, which is the need of an hour indeed. And I would want to thank all the panelists to take out their time for discussing such an important topic on this occasion, which is just post Women's Day. And uh, we have the moderator for the session today is Dr. Madhuri Kasi, and it's a privilege to introduce her. She is the lady who wears multiple hats. She's the director of Eagle Touch, and she's the founding director of School of Physiotherapy at Geetham University, a lady who has more than 22 years of experience. She also chairs the IAP guidelines for developing different guidelines for the Indian Association of Physiotherapists. And today she'll be moderating this session. Currently, she is also serving as IAPWC state head for Telangana. And with a lot of gratitude, I would want to welcome you, ma'am, to moderate this session. And I would want to hand over the session to you. Also, special mention to Nehal Shah, ma'am, for gracing this occasion with her presence, who is always encouraging and very supportive. So, ma'am, over to you.
Thank you so much, Dr. Dara. That was so kind of you for such a nice introduction. I'm so glad to be on this platform and this webinar on this very important topic, as you rightly mentioned. First of all, I would like to congratulate IAP and IAPWC Gujarat team for organizing such a webinar on this important topic. And also IAP and IAPWC Women's Cell for the International Women's Day, Women's Week, Women's Month. I think it is every day now we're going to celebrate Women's Day, as everyone says. So I wish you all the very best. So coming to and of course, IAP and IAPWC for taking this very important initiative for developing the clinical practice guidelines, which is not only going to positively impact the physiotherapist practicing across the country, but also the patient outcomes. So clinical practice guidelines, as we have been talking about, are evidence-based statements or the recommendations. They are synthesis of all the advanced or the most recent evidences, and also improves the patient outcomes, as we have been talking about it, and there's a lot of buzz about it. So today, let's find out from our panel of experts how it happens and why is that so important at this time. So I would like to introduce our wonderful panel members today. We have Professor and Head at APJ Abdul Kalam College of Physiotherapy with 17 years of experience, who is the district coordinator of Ahalya Nagar branch and also a member of the editorial board IAP Journal. She has visited multiple countries and is interested in the internationalization and the cultural competency and also in women's health. I welcome Dr. Deepali Pandey on the panel.
Thank you. Thank you so much, ma'am, for having me.
Thank you, ma'am. Next, we have somebody who has been in women health for 17 years as in the clinical practice. She is the owner and the chief physiotherapist of Saki Women's Health Physiotherapy Center at Surat. And she has been the resource person for many of the courses and webinars on women health in several colleges across the country. She is also the author of the guidelines of postpartum rehabilitation guidelines published by the IAP. I welcome Dr. Khushbu Thakkar on the panel.
Thank you. Thank you so much, ma'am. Thank you for inviting me as a panelist. Thank you.
Thank you. Next, we have somebody who is very senior, very approachable, wonderful to work with 35 years of experience in the field, who is an academician at SBB College of Physiotherapy, Ahmedabad, and has published about 6 books with and also many research papers, and she has a keen interest in research and ethics, and I am so honored to be happy to be working with Dr. Megha Seth ma'am. I welcome you, ma'am, on the panel.
Thank you, Madhuri ma'am. Thank you all the panelists for joining us today. A very good afternoon to all participants.
Next, we have an associate professor from the very busy John Hopkins Medical College and Hospital in Bangalore. She has 24 years of experience in women health. She is also the author and editor of the clinical practice guidelines for pelvic floor and women's health by the IAP. I welcome Dr. Smita Joseph, ma'am, on the panel.
Thank you, ma'am. Thank you for inviting me to be a panelist here, and a very warm good afternoon to all the participants.
Thank you, ma'am. Next, we have somebody who is very energetic, who is the favorite among all the students, and who has 8 years experience. And in that 8 years experience, she has completed her PhD. She's an associate professor at Ashok and Rita Panel Institute of Physiotherapy, Charuset. She is the district coordinator for KEDA branch, and she has multiple awards like the Women Icon Award, and also secured some research grants, 1 copyright registration, 2 books, 10 research papers, and awarded the bursary for the World Physiotherapy Congress 2023. Let's welcome Dr. Heta Patel.
Thank you, ma'am. Thank you so much. It's an honor to be like a panelist with the esteemed speakers over here.
Thank you. So we've been talking about the clinical practice guidelines so much, and that they are important, that they're going to impact so many things in a positive way. So let's hear from the panel as in the current landscape, in the current practice of physical therapy in India, physiotherapy in India, and women's health being a very complex or one of the complex situations or complex topics, and women's health being a relatively newer specialization which has been added in the scope of physiotherapy practice. Let us see how this complex physiotherapy has is currently practicing in different parts of India. Is there any cultural sensitization, or how are the ethical practices? And let's find it out from Dr. Deepali Pandey.
Good afternoon, everyone. Before starting the panel discussion, I would like to thank IAP and IAPWC Gujarat branch for organizing this panel discussion on a very important topic. So as we all know that when physiotherapy has started, everyone was thought that physiotherapy is only for musculoskeletal problems. And if we see the global trend, than physiotherapy overall has more awareness and more physiotherapy practices or more evidence-based studies we have in high-income countries compared to low-income countries. And same trend we see in India also. If we see first and say, two-tier city, and if we compare that with the rural part of India, then definitely the awareness of physiotherapy in rural India is very less. So we have to work a lot to increase the awareness, because we know that 80% of the population of India stays in rural part of India. Then, as the misconception that physiotherapy is only for musculoskeletal problems it is changing. The trend is definitely improving, and now because of the awareness and we can take example like from social media and from the stalwarts who are working in women's health area. Now, physiotherapy in women's health is like a pivotal in treating variety of issues in obstetric and gynecological issues. Postnatal problems are also tackled by physiotherapy. Even the problems which are faced by adolescent girls, take example of PCOD or dysmenorrhea, are treated by physiotherapy. Before we were having, I say that this is also one of the disadvantage, that most of the time we are dependent on the referrals, because these problems, they will be first reported by the gynecologist or obstetrician. So the previous trend was that there was a low referral, but now definitely awareness is increasing, and because of that, now we are also getting lot of referral for different kind of issues which are related to women's health. Physiotherapy, it is a part of a multidisciplinary team, and that is why it is very important that the all healthcare professionals has to be educated that what is the role of physiotherapy in women's health. If we see the in the past, we were having few articles based on a pelvic floor treatment in various gynecological problem, and now we are getting cases of problems in vagina or pain or spasm in vagina. So now I feel that definitely the awareness has improved, and before we were having taboo related to conditions of women's health, but now definitely the taboo has decreased, and I feel all the wonderful physiotherapists who are working in women's health, they have definitely worked hard to create the awareness.
Thank you so much, ma'am. So when you're talking so much about the referrals and with the increased awareness and different professionals referring their patients to us, I would like to direct this question to Dr. Khushbu Thakkar, ma'am, who's been on the clinical practice for a long time. As how is the current landscape? Like currently, how is it done that does the different other healthcare professionals, are they aware of what we exactly do, and is it clear the role of the physiotherapist to them? So are there any challenges in that area, like the boundaries or during the referral from even the other physiotherapists? Is there any standardization? Is the expectation understood? So what are the challenges you're facing at this time?
Okay. Thank you, ma'am. First and foremost, again, very good afternoon to everyone, to the panelists and to all the participants. And thank you for inviting me as a panelist over here again. So yes, challenges have been many. And as years have passed by, because when I passed out, like my post-graduation was over in 2010. So it's been 15 years that it is like an uphill ride. So initially explaining that, or the boundary of making people understand that what a women's health physiotherapist does, was definitely a big challenge. So initially, what physiotherapy was, to explain that, that was a challenge. Then it came, as you already mentioned, Dr. Madhuri, that it is a very complex field, but it is a very integrated field. And in whichever way, if we say that any I mean, it could be any field. It has to be very patient centric. So each and every professional should be understanding that this is their role. So, for example, if we are talking about a women's health physiotherapist, like there can be multiple issues, gynecological issues or obstetric issues. So, if whatever that a gynecologist does, it's from the medicine point. But whenever it is coming like the conservative management, where medicines are not prescribed, so it could be menstrual issues, or it could be pregnancy, the antepartum, that is the pregnancy, labor, and the postpartum period, or it could be the menopausal women, or it could be the spectrum from the young girl to the adult or a mature woman. All the issues, when we are talking about the conservative management, it can be dealt by a women's health physiotherapist. So challenges, definitely there are a lot. Awareness, it is gradually spreading, and I'm very happy that it is spreading at least. What I would really want is that not only the other professionals, like not the other medical professionals, but also the physiotherapists who are not practicing women's health, but who are into musculoskeletal or any other field, they should also be promoting this, that it is a very skillful and a very specialized field, and a specialized person who is aware about how to deal with a woman's health problem. It has to go to someone who knows the issues. Because as I had already mentioned earlier also, that the pelvic floor itself is a topic, or the pelvic floor is something which you have to feel it. All right. So someone who has not experienced about how to manage these issues, it is very difficult to make them understand that, okay, like by a telephonic call, that you have to treat this patient like this. Because there are times people are like, I would probably like to see a YouTube video, or I would just like to probably you tell me what has to be done. But I think it is a little bit of a challenge to explain someone that how to assess a pelvic floor just by saying it. You need to have a skilled personnel doing that. And awareness is one thing that we definitely is not only among the other professionals, but also among the physios, like, fellow physios, we need to make a boundary that this has to be done by a skilled professional and this has to be done by this person. So I think that is one of the challenge that I have faced as a clinician, but yes, it is improving day by day.
So good to hear that. And that is so true that the awareness is improving, but it is still kind of disorganized and it is scattered. Where to kind of draw the line, and where it is coming under the specialized pelvic floor therapist, pelvic women's health physio, and what the others do. So there are so many conditions which are being added into this particular specialization, and our curriculums across the country, the training and curriculum across the country, I think many of the universities have updated, but some of them are still updating in the process. So I would like to ask Dr. Megha ma'am, who has so much of experience guiding students, mentoring PGs and PhD students with such a rich experience. May I ask you, ma'am, as how is our training and how is the education supporting this kind of a change and this kind of new additions into the scope of practice in women's health, basically?
Good afternoon once again. I think as you mentioned that women's health is a new topic that is upcoming. And I think even Dipali ma'am said it, who also said that you have problems. We have problems getting patients coming to us. The actual history is that physiotherapy in obstetrics and gynecology has been existing since World War II. So 1944 के पहले से भी we as physios we have been treating women, but only in the field of pregnancy, labor, and obstetrics and gynecology. So if you look at the specialty groups in UK, the Chartered Society of Physiotherapists, they made their group for obstetrics and gynecological physiotherapy in 1948. APTA came about in 1977, again for obstetrics and gynecology. And then around 1995, the MSK physios, which Khushbu has been talking about, that as a physio, I am not able to treat a patient. So these musculoskeletal physiotherapists, who are the most common, they started getting patients of pelvic pain and incontinence. And they were unable to treat this. So they realized that there is something else that exists. The pelvic floor and incontinence is not part of the MSK branch, And so then women's health started coming around. So till 1999, it was mainly pregnancy that was being treated by physiotherapists. And in 1999, even the World Physiotherapy now, WCPT at that time, they made this specialty branch of women's health. As I think we are growing, we realize that everyone who has a pelvis is going to have a pelvic health problem. So APTA or USA then in 2019 has decided to change even women's health into pelvic health. So they now even include men's pelvis as pelvic health issues. So I think all of us, when we were in college, we have focused more on learning about the role of physiotherapy in pregnancy, obstetrics and gynecology. And more recently, we are learning about the pelvic floor as well. But pelvic floor more as incontinence. So it's a weak pelvic floor. But on the same side, we also have something like a tight pelvic floor or pelvic floor which is not relaxing. And that gives a lot of issues as well, which is not being incorporated by most syllabus at the undergraduate level. So when a physiotherapy graduate comes out into the world, they'll understand women's health as pregnancy and incontinence. But like Khushbu and Dipali ma'am both have been saying, the scope of physiotherapy is from the womb to the tomb. So the adolescence, PCOD, PMS, we have a big role even in PMS. So that comes during the younger age. When we are talking of the middle health woman, we have pregnancy, but we also have sexual dysfunctions. Now, women may be coming around saying that, yes, it is a problem. Earlier on, it used to just be destiny that we have to undergo all of this. Even if it is painful, it is part of our life. So there was vaginismus, incontinence that came up. And then we have women's health in the elderly female, which focuses on osteoporosis, sarcopenia nowadays, cognitive issues, depression. As a woman, we always thought that we are protected by our hormones. And now, because menopause ke baad we are living a longer life, we also have to live without the hormones and we are more prone to cardiac events. So weight gain, obesity is also a major issue in women's health. So the scope of practice does include a lot, and eventually it is the frail old woman who is still living because of medicine and longevity. So I think our scope of practice is changing a lot, and this needs to be incorporated into the syllabus even at an undergraduate level because women are now getting aware. Like Khushbu said, she is getting more patients, and we have a lot of upcoming women physiotherapists in women's health. So this syllabus needs to change, needs to modify so that it can include all of this. And I think even ethics needs to be included because whenever you are going to assess a woman, you have to have her consent. She needs to know when it can stop, how comfortable she is. So that also needs to be understood at an undergrad level. I think women's health is more studied at a postgraduate level in the physios who are interested in the topic. But yeah, the scope is too vast and we need to introduce it a little more in detail in the undergraduate.
I'm so looking forward for adding this topic in our undergraduate, maybe a little more, and then as a background for the postgraduate.
Yeah, let's see what the NCAHP does.
Right.
Maybe it will get something more uniform.
Yes, that will be great. Surprisingly, in a pleasant way, we have good number of physios who are women who are practicing, and men also, physios who are practicing women health and pelvic floor physiotherapy. That is great. And there is a lot of research which has been put into the different areas of this women health. So which is great. So I just wanted to understand, does this research, which has actually increased in the past few years, is it actually serving when we are looking at a particular condition? Is it connected? Is it flowing? And is it in a way that we can actually gather information, meaningful information, treatment or technique wise, when we are looking at formulating these guidelines, or when we are looking at any one particular condition, or are there still gaps? I would like to ask this question to Dr. Smitha Joseph, ma'am, because you've been also into a lot of research. So what is your take on this? Ma'am, you're on mute.
Okay, thank you, ma'am. Thank you for for inviting me to participate in this, and thank you, IAPWC. And yes, there is like all our esteemed speakers, they have been telling us, our esteemed panelists, like they have been discussing with us, there is awareness that is created, but again, there is a lot of gap in literature. Like when we were trying to formulate the clinical practice guidelines, what we came across is, yes, the awareness is definitely improving, but then there is still so much work to be done. We first and foremost, we need to identify the general concept is that when you are talking about women's health, it is only related to pregnancy, it is only related to the sexual health, but there is more to it. Like Megha ma'am was telling, expressing with us, when you look at the UG, the undergrad curriculum also, when they discuss about women's health physiotherapy, it is only related to the pregnancy, it is related to the pelvic floor. Now it is increasing, okay, but there is much more beyond that also. Almost 56%, like research when we were doing, when we were trying to collect evidence, what we came across was that approximately 56% of burden comes from health conditions that are more prevalent or that is manifested differently in women. Only 43% come from conditions that are not affecting women disproportionately. We have to understand the role of the sex chromosome also. That is that plays a major role in women's health. The other thing is how these conditions, Megha ma'am was also suggesting that we have the old women who are living because of medications, because of their longevity. Yes, because there is how the cardiovascular, how these hormones that are present among in women, how it affects the cardiovascular health of the woman, how it affects the mental health of the woman, the role of hormones at what stage, how the woman reacts or how the woman responds. It is a generalized research that is performed. It is not specific. The pathophysiology underlying for each condition, that is not looked into. That is the gap that we found. And most of the times what happens is this research, that is like whatever research is available, it is many of the times it is paid. It is not available freely. So what happens is the healthcare professionals, the therapists, for example, what they do is they just collect whatever is available online, whatever the internet suggests. Now that may or may not be, many a times, like it is just something that is put up. It is up to the user to decipher whether it is really applicable, whether what is the scientific basis, what is the pathophysiology behind that. So most of the times it becomes confusing. It is not readily available. The research is not readily available. All these are the gaps that we came across while we were trying to formulate the clinical practice guidelines. And many of the times, yes, we agree that there is a lot of research that is coming up on aging, on menopause. But okay, a simple fact that a woman who undergoes a surgical menopause, and the difference between a woman who undergoes a surgical menopause and a woman who undergoes natural menopause. Natural menopause happens over a period of time. So the woman is aware, the woman gets adapted to the changes that are the hormonal changes that are taking place. She gets time, she gets adequate time. She is in a frame of mind, she is expecting that. A woman who has an emergency hysterectomy, who undergoes a sudden surgical menopause, it is a total contrast. But the research, or when any studies are done, when any research is done, they don't really look into whether it was a sudden surgical menopause that the lady had to undergo, or was there a gradual change. So all that affects the end result of it, the data that is available. So how that difference, so all these are the gaps that we came across. Now even for the new, like for example, when we are looking at the next generation, there has to be more awareness that is created. And also, there are many areas where funding is unavailable for research. So if the funds are unavailable, the conditions that are more prevalent, the funding should be made available based on the prevalence that is there, and the education and training has to happen in that manner, so that the funds are also optimally used and the awareness is also optimally created. Now, even Deepali ma'am was talking about the taboo that is present. Research shows that almost 83% of Indian women still do not come forward with health issues, considering it as a taboo. They do not want to be a burden on their immediate family. They do not want to come. Until and unless it is unbearable, they don't have any option, then they come forward. So that awareness has to be generated even among the public about the scope of physiotherapy in women's health. Women's health is not only restricted to research in pregnancy or research in pelvic floor. There is much more to be done. And yeah, this is an initiative that was taken up by IAP, and hats off to you. Like, though we are late, but better late than never. We are moving forward, and like we have the saying, no, tipu tipu sarovar bharai. So we will go slowly. We will work up slowly, little by little. We will move forward as a team.
That's wonderful, ma'am. That's really encouraging words. That's really good. And from what you say, that there is a literature available, but then there are gaps in literature. But before we go into that, I wanted to understand from Dr. Hetha Patel that this whatever research or whatever clinical trials have been done, relatively in the recent years, they were definitely a little more than what was with before in this area of the pelvic health. So, and everybody, almost everyone is talking about evidence-based practices, evidence-based tools and techniques. So that is a very a famous word, evidence-based practice. So I just wanted to understand your view on, is the existing research or the existing evidences being translated to practice in the different parts of the country, like not only in just the cities, in different parts of the country? How do you think is evidence-based practice?
A warm greetings to all. I'm delighted to be a part of this esteemed panel. And thank you, IAP and IAP Women's Health Gujarat, for creating this platform to discuss such a crucial aspect on women's health. It also bridges the gap between the research and clinical practice as an evidence-based practice. So over the past few decades, we have seen that surge in evidence-based research is shaping and in the treatment protocols and even in the various conditions identification as well. So from pregnancy to postpartum care, to menopause and pelvic floor dysfunction. But the real question is, are this advancement truly reaching to physiotherapists in everyday practice or not? So as an educationalist, if I talk, then while we are moving towards the evidence-based physiotherapy, implementation remains a challenge. The availability of guidelines does not automatically translate into their application in real world. Several factors that influence to this: awareness, accessibility, then feasibility, and some of the physiotherapists, especially in the resource limited setting, like rural area, and or the training part to integrate this into the practice. So other may be constrained by institutional protocols, or they might be yet to involve in emerging research as well. But let's consider one example, pelvic floor rehabilitation. So we now highlight have the high quality of evidence supporting tailor-made exercises, protocols for urinary incontinence and prolapse. I guess Megha ma'am can and Smita ma'am also can correlate because our one of the component of that. So, however, are all physiotherapists following these updates and approaches, or some of still relying on the conventional methods? Similarly, when we are talking the advancement of diastasis recti, so rehabilitation, and menopause-related musculoskeletal care. And the pain management during the pregnancy should be widely incorporated, but yet standardization still is lacking in many of the places. Another key factor is continuing education and mentorship. Are we ensuring that practices of physiotherapists both in urban and rural setting are the same, or receiving the treatments they are updated? The digital learning platforms and workshops and interdisciplinary collaborations, even the partnerships, plays a major role in making this transition seamless. But what extent we are specifically using them? If I'll conclude this, then ultimately the evidence-based practice is not just about having the guidelines. It's about integrating them into a patient care efficiently as a community, and we need to emphasize knowledge and translations, making sure that every physiotherapist, regardless of if they are from rural or they are from urban area, or their location or their resources, has access to update this protocol. And the goal is very simple, that better outcome of for a woman through a physiotherapy that is rooted into latest scientific advancements. And their requirements are collective efforts and research for researchers, educators, clinicians, even policymakers, and they needs to be hand in hand. Another thing, so one of the effort from our IAP is that these 3 books are launching. That's one of the effort. And this also needs to be rich in such a widely, and even this sort of panel discussions by arranging from Megha Ma'am and IAP and IAP Women's Health Gujarat can at least have that benchmark for this sort of implementation of evidence-based practices. Thank you.
Thank you so much, Heta ma'am. That was so true that all of the evidences are not translating into practice yet completely as much as we want. And when we are looking at the current landscape, we are seeing lacunae not only in the evidence is translating to practice, but also in the syllabus, but also in the clinical practices, and also cultural and ethics wise and research wise. There are so many different things that we can still definitely improve on. And it is actually glaring at our face that we need to change it. We need to implement it at this time. So I would want to ask Dr. Megha ma'am on how are these, what are the steps which are implemented in clinical in developing these clinical practice guidelines? What are all the resources which are utilized, and the processes which are being taken care of, so that we come up with the most current and the evidence-based recommendations which can be used by all the practicing physiotherapists? And why do you think it is important at this time? Over to you.
Like you began the session, clinical practice guidelines are statements which include recommendations to optimize patient care. So as physiotherapists, we all want our patients to get better. And the clinical practice guidelines are offering the recommendations that is going to help fulfill your goal. So that is what CPGs are. And the best thing is that it is informed, or it is made through systematic reviews. It's not something that I like or I practice. The recommendations are based on what literature says. So we are right now in an era of evidence-based practice, EBP. The 3 pillars of EBP are evidences, clinical expertise, and patient preferences. So our clinical expertise does not go anywhere. We still have to use it along with the evidence. Now, whenever we put something into the Google that what are the evidences for this, we're going to get a whole list of evidences which we cannot read or go through. So what the clinical practice guidelines do is makes your work easy by giving you the SAR of all these evidences. It gives you the gist of all the evidences which has gone through rigorous review. So this CPGs are for clinicians. It's not as much as for academicians or for research as much as it is for the clinicians, so that their practice can be standardized and it is evidence-based. So in the hierarchy of evidence, if now we see systematic reviews and meta-analysis were the highest, now I think CPGs go above that because they're going to be based on what systematic reviews say. CPGs also include assessment and the assessment of benefits and harms of alternative care. So it is not only what medicine says, but because our patients want to try out other things as well. So what is the role of yoga or something can also be incorporated into these CPGs. So how is these CPGs coming about? What are the steps? The first one is to define the clinical problem. So as we've been discussing for the last half an hour or a little more, women's health is definitely a topic which is important, changing for the last 50 years. And there are many questions that do arise. What do we do in certain conditions which were not taught to us in our syllabus? But like COVID was not in our syllabus, but still we had COVID and we came out from it. Women's health, women's problems are something that's part of our life, and we have to, as clinicians, be able to treat them. So if a person comes to us with pelvic pain, we need to manage it. If a person, even cancer has increased so much nowadays. Uterus cancer, cervical cancers are only things which women have. Breast cancers are also common only in the woman. So we first identify the clinical problem. We identify the research gap or the knowledge gap, and then we try and make the research question in the PICO format, the population, intervention, comparison, and outcome. And then we try and move ahead. So the first thing in moving ahead is forming the guideline development group. So you need to identify people who can find answers to these questions, who know about it. And this includes both medical and non-medical people, because eventually it has to be followed, or it goes across to even the lay people. They are also able to understand and read it. Once the guideline development group or the GDG group is made, we need to go and start looking at what the references say. So what Smita ma'am was saying, that as we made these guidelines for women's health, we realized that evidences exist in certain places, does not exist. So what does evidence say, and what do we give across to our professionals from here? And the most important part about the systematic review is that the articles are going to be reviewed rigorously. It's not just finding the evidence and quoting it, but we also need to know what is the validity of that article or the evidence. Was it methodically correct? Is it applicable to our population? And then we can make a recommendation based on that. So whatever evidences we gather, we need to grade it, whether the study was, what is the level of evidence, and based on the level of evidences, we have a recommendation in the clinical practice guideline that there is a strong recommendation for using this technique, or there is a poor recommendation. A poor recommendation does not mean that you cannot use it. It just says that the evidence for this is not as good, but and that leads us to the next step, where you need to keep updating the clinical practice guidelines. So if evidence was not available today, it may be available after some years. So whatever clinical practice guidelines are made today, the last step would be updating them. But in the middle, like Heta said, we need to get these clinical practice guidelines translated into practice, got across. So the dissemination part, which we are trying to do today, we're trying to encourage people, physiotherapists of India, to read these clinical practice guidelines so that we can get a standardized care across India. So even patients nowadays, they don't just walk in with a problem. They have already done some research, some homework at home on their phone. So they're going to have questions for you. And if we as a team of physiotherapists can develop clinical practice guidelines where we are all on the same page, it probably helps our profession grow a little better.
Thank you so much for explaining in detail the complex process of development of CPGs, and thank you for being so instrumental in developing them. That was really rewarding, and the book seems to be such a rich source of knowledge, because it is not only going to help the therapist but also the patient outcomes. Talking about which, this guidelines also include the different aspects of practice, including the ethics, not only the clinical knowledge, not only the evidence of the clinical knowledge, but something which is a little more a kind of a soft skill or something which is integral to all the clinicians, but then it also includes something like a sensitive to the cultures and ethics. So Deepali ma'am, what do you think? How do you think these guidelines or the CPGs help in that aspects? And why do you think it is so important at this time to integrate or follow these things?
In this, I feel that the holistic approach towards physiotherapy in women's health is very important, because we as a physiotherapist, we don't see patients only physical issues. Whenever the patient is having any kind of musculoskeletal problem or any issue which is related to pelvic cavity, yes, physical component is there, but emotional and mental component is also very important. Very important other aspect is that the environment in which the woman is living is also very important. The surrounding, the social atmosphere, that is also very important. Just now, Smita ma'am said that mental health is a very important issue, and I feel that in general population also we are not working too much on mental health issues. So if we go to research, then postpartum depression comes from 4% to 48.5%, and postmenopausal depression comes around 22%. So if we are not going to deal with the mental issues, whatever physiotherapy or whatever treatment that we give to the patient will not have the patient will not recover. So I feel that it is very important that we need to work on this. So whenever we are working with these kind of issues, communication is very important. As the culture changes, we as a country we are having a lot of diversity, and people come from different cultural background. So that is why communication is very important. If we talk about childbirth, still we are having lot of beliefs and lot of practices which are going around. I think that in cities we don't commonly see this, but if we talk about rural area or the places where still the awareness is not there, lot of practices which are still going on. Take example of not giving colostrum to the baby because that milk is not good for the baby. Still lot of people think like that. But because of this, what is happening? The problem of breast engorgement and then mastitis, which is very painful condition, is also increasing. So we need to also work on this. But as a physiotherapist, I feel that solely we cannot work on this. These are the social issues where the team has to work. Then the next thing is that if we talk about if we talk about the holistic approaches, then we have different herbal remedies. Then we have therapeutic massage, meditation, mindfulness. Nowadays, this I don't know whether it is practiced in other part of India. That is Kasya Thali therapy. So we have a rotating therapy, this thali, which is made up of mix of bronze and mix of copper. And on that plate, they have different spikes on which the patient will put the foot, and it actually stimulates, it works on reflexology. So that kind of different therapies are also going on. Just now, Heta ma'am and Megha ma'am said that whenever we are having pelvis, so issues of pelvis will be there. Mothers are going to produce babies, and the postnatal problems will be there. If we talk about the research, if we want that our guidelines has to be inculcate in the society, then I feel that collaborative projects with gynecologists are very important. If we are going to do research only with the physiotherapist, I feel that we are not going to spread this message. Whatever guidelines now we are having, we cannot put everything on the internet, but I feel that part of it has to be there on internet. So whenever anyone is searching on Google, some part of guidelines will be there. So I feel that these kinds of different approaches will definitely helpful, and collaborative project with the gynecologist are going to be really very helpful. And just now Khushbu ma'am said that awareness among physiotherapists is very important. Generally, what physiotherapists feel that though they are having a specialty in clinical practice, they treat all the patients because they don't want to lose the patient. But I feel that women's health is not like other specialties. Here, you need to have expertise, and all the physiotherapists who are working in clinical area or in academics, they have to make sure that if they come across with any kind of this kind of problem, they have to refer the patient to women's health specialist.
Thank you so much, ma'am. And as you rightly said, in one of the steps of the clinical practice CPG development, all the different stakeholders are involved as a group. And the review is when the external review of the CPGs is done, it is sent to all the different stakeholders, their opinion and the feedback of the exercises and the protocols also will be taken. So that is a very important point that you mentioned, that all the stakeholders have to be involved. Thank you so much for that. Talking about which, actually, when we are talking about the different practitioners or different healthcare professionals working with the same patient on a particular condition. Dr. Khushbu ma'am, what do you think? How do you think the clinical practice guidelines would help not only the patient outcomes in terms of physiotherapy, but in terms of the overall patient outcomes, when the other healthcare professionals are also involved, when the role of the physiotherapy is particularly defined and we have said that, okay, this is what we are going to achieve and we are going to achieve it. So how do you think that's going to improve the patient outcomes overall?
So the clinical practice guidelines, I think they are like a reference. So as I think Megha ma'am has said, that you cannot, if there is something which is, there is a strong evidence, there is a moderate evidence, there could be a low evidence. It doesn't mean that the one which is having a low evidence is not going to help the patient. So each and every patient is going to be different, and each and every therapist have to use their clinical knowledge as a backup, or to process that how this patient is going to get improved. And as already Dr. Dipali was just talking about, that when you are seeing a patient, it is just not the physical aspect that you are seeing. You have to see the patient as a whole. Definitely, as pelvic floor therapist, we are going to check the pelvic floor and the pelvis, but we see the patient from top to bottom. And as a therapist or as a pelvic floor therapist, we understand the boundary or the limitation that we have to take into account while seeing a client or a patient. The referral or the clinical practice guidelines that we are having can be utilized as a reference book, wherein we can understand that, okay, this is what is research based, which is going to be very, very, very crucial when you are seeing a client, because obviously there are so many options available which opens up when you are seeing a client or a patient, that, okay, I can do this with her today, or I can probably try this with her today, obviously on the basis of your knowledge and your experience. But sometimes your experience could be limited because that is the type of patient you might have seen in that particular sector. But when you have a backup as good as the CPG, which Dr. Megha ma'am was saying, that it comes now above the systematic reviews, or it is considered to be one of the topmost referral thing which you can see, that, okay, this is what we can be using it, on the basis of which the patient outcome is going to be much more better. So you're basically saving a lot of resources, specifically you're obviously money from the patient's end. That is what we are saying, because we all are practicing in an urban area. If that is a rural, and if we are doing service, that's a different aspect. But yes, time. You are not just running around the bush, because you have something like it's a pathway. which is giving you a little more, as the name suggests, it's a guideline. Probably it might not work for your patient the way you might have assumed it to work, but it definitely gives you a good reference point to start. And it works for everyone because it is, when it comes from a body like IAP or any such body, it is more accessible and people have more trust in it. Probably if you as a person or as a clinician say that, okay, this has worked and I have done my research and I have done my this is evidence based, you saying it, or probably it comes from a body like IAP, it makes a lot of difference because it is going to be utilized not only by the therapist, as it is open for all. It is also for the other professionals. It is also for the therapists who have just passed out, or the MSK therapist, or whomsoever who is referring it. So the guidelines are going to be extremely important. And I think everyone in the fraternity is very happy that it has come up in women's health, which itself is a very complex and integrated approach in general to any patient for that matter. So I think I'm very happy to be a part of it, and I'm looking forward for the book launch. And so many people are asking also that when is it going to come? And once, as Dr. Dipali is saying, that probably there some part of it is put on the internet, so people are like really enthusiastic, and I'm sure they should be. So because that was a lot of effort put in by all the members over here who are co-authoring with us, and I think that's an amazing effort. And I think we still take it a step further. We keep do a lot of research on it, give our own clinical opinion about it, and I think that is the way how it should go. Yeah.
That's wonderful. Yeah, definitely we are going to update it. This is only the first one, and we're going to have a team who will be updating it. And yeah, that is the exciting part of it. So talking about which, as Smita ma'am, you mentioned that there were gaps already when you were looking at in the existing literature, the existing knowledge base. So how do you think having these guidelines already made can help us find out those or fill those gaps? Do you think it will direct the research or direct more number of students and PhD scholars to pick up those points?
Yes, ma'am. Actually, what we have seen, like we have identified the gaps. Now it can work as a guideline, like as a pathway for the future generation, for the next generation to take up these gaps and identifying these gaps to take it up as research projects, as the research question for the forthcoming research. Like Megha ma'am was suggesting, like in the PICO format, the research question, formulate the research question based on these gaps that we have identified. And there is so much work that can be done. There are so many unresolved questions. These itself can be a guideline or pave the path for future research. So how the next generation now, for example, when we are making this CPG available, our main this thing is people who are apprehensive. What can be done? What can be done to help the patient? What should not be done? What are the harms and what are the benefits that will come out from their interventions? All that, this can be like a quick reference that is evidence based, that has been studied upon, that has been researched upon. So these CPGs, the guidelines, will help more and more therapists, more and more physiotherapists also to be more interested in this field of women's health. How they, like, always when there is an apprehension, when there is a fear, you don't know, the unknown is always uninteresting. Okay, so something that when it is available, there is a guideline available, there can be something that can be done. When you have help available, people will be more and more interested in working in this, and we will have more help coming in for women who are suffering, for the women's health in the future. So like and there can be new trends that can be emerging based on these. So when people know that it is approachable, it can be done, we can help, we can do so much to help these patients. When they understand that, there will be more and more new research that comes in. So with more and more research that is coming in, more and more awareness, more and more it becomes optimally available for the suffering woman, and that can take care of the global health disparities also that are currently prevalent. Okay, and it becomes more and more of a personalized therapy or a personalized approach. people try to inculcate more of these guidelines into their practice. So, and they can also, then they start understanding, okay, what may be the reason, what may be the positive factor, the interest develops both for the treating therapist, for the other healthcare professionals. When the other healthcare professionals see that the physios can actually help, this is how they can help out, so it increases their interest also. So there will be more and more referrals that come in. And yes, like I told, even in my previous talk, I told this is the need of the hour. We need to get more and more involved. Like ma'am was telling, as long as women are there, pelvic floor dysfunctions will happen. We will have women's health issues. So more the number of people get involved in the care, in the therapy to execute, and with the help of these guidelines, there would be more, it would rise up. The evidence, the research would rise up, the therapy, the care would rise up, and it would be optimally available for all women who are suffering.
So rightly said, Smita ma'am. Thank you so much. Dr. Hita ma'am, you have previously mentioned that lack of availability of the tools, resources, time, and also the skill also sometimes can stop the practitioners from looking up for the evidence. The recent or the most advanced evidence available in a particular topic or a technique for practicing the better patient outcomes or gaining the better patient outcomes. So how do you think clinical practice guidelines or the CPGs can help overcome that barrier? And what are the different disseminating, or like how can we spread this word? What is your take on it?
The discussion on utilization and the strengthening of evidence-based physiotherapy in women's health, the clinical practice guidelines are the more than just a compilation of a best practices. Even they are the cornerstone for the quality of care. And this transforming into a scientific discoveries into standardization, accessible, and impactful treatment. So while we have an abundance of high quality research, and the real challenge lies in the which ensures the knowledge and which reaches to every physiotherapist, especially to underserved and the resource limited setting. Without a structured evidence-based approach, there is a risk for inconsistency, outdated treatments, and even the suboptimal patient outcomes. So CPG can serve there an essential guide, even which offers a step-by-step research back protocols, and even that empowers the physiotherapist, even the professionals, and not only the physiotherapists, but for the doctors as well. They also aware and making our students also to empower and making them informed that clinical decisions within confidence and precision can be taken. However, the gap between the research and practice persists, but largely due to the accessibility barrier, lack of accessibility, even the institution enforcement, and even insufficient training and opportunities. But many physiotherapists, particularly those who are in the remote areas, may not have the immediate access to latest studies, clinical trials, and even the expert recommendations. This is possible, but which are the quality of remarcation that also lacking? How do graded them? That also lacking. So this is where the CPG plays a transformative role by simplifying it, the complex research, and making it to a very simplified one, making it a structured one, simplified one, and approachable one. And even there is an this specifically, if we'll talk that the some sort of perspective for considering, if I take this example of pelvic floor girdle pain during the pregnancy, a condition is affecting to millions of people and millions of women in the globally. But research now strongly support that tailored stabilized exercises, manual therapy, and specific movement modifications can be helpful, and it is more effective in the treatment strategies as well. And even the many practitioners are also still rely on the outdated pain management that offers a temporary relief, but but sometimes it fails to address the root cause. And even this can be correlate by Khushbu ma'am can correlate very well, because the problem is very minimal, but we are giving in such a curative form, so that the patients also understand that it is the treatments are so enlarged one, but the cause of the root, if we'll identify very simplified, if we'll identify, then the treatment and the if can be the effective one. Another, the CPG can be ensuring every physiotherapist is with the most effective research-driven interventions, leading the faster recovery and reduce the discomfort, even and then the overall improvement in the maternal well-being from a antenatal to a postnatal one, and even after the postnatal care as well. The gap, to bridge this gap between the scientific advancement and widespread clinical population, there are we actually must to focus on expanding the accessibility. That we can have it through a mobile apps, tele-rehabilitation platforms, even the regionally adapted educational resources, the translated one, the resources. The another is institutionalizing the CPG adherence, making the standard of care in hospitals, universities, or clinical setup, as in when the student starts learning from there, we need to have that. Another thing is customization of global recommendations. So that needs to be aligned with the treatment protocols for, if we'll talk about India, then it needs to be aligned with the global protocols as well. And along with that, the important aspect is infrastructure and the available resources for women's health patients. Another is required is continuous professional education, which is at most updating oneself. This also makes a very important role, and the need of an hour becomes women's health physiotherapy is not just about a treatment, it's about empowering equality and the progress. When women receives the best possible care, they thrive, so do their families, communities, and future generation. By ensuring this evidence-based practices reaches to every woman, and irrespective of any local or the rural area or the urban area. But towards the future and quality of care and right, not in privilege, but it is also merely academic discussion, which can we need to. It's not again. It is not only the academic discussion. We need to take the action plan is also required. CPG guidelines can helpful at most over this to enhance these activities.
Thank you so much, Heta ma'am. That's really true. The best part of all the things that you've mentioned, that the CPGs are simplified, they're accessible, and the most effective in achieving better patient outcomes. So thank you so much, all of you. And what I hear from all of you is CPGs are the required tools for achieving better patient outcomes. And ultimately, that is our ultimate goal, to get better outcomes. And with easy access to the patient, to the physios, they are the most needed now, because we are transforming our clinical practice in so many different ways. So clinical practice guidelines, or the CPGs, being the synthesis of all the recent or the most advanced evidences, these incorporating them and following them as a guideline only or as a recommendation is definitely helpful. And not only we saying that, we have seen that in both the education and the syllabus and training aspect, clinical practice aspect, cultural sensitivity aspect, the research aspect, furthering the research, and translating that research into practice. In every way, the CPGs are proving, or in our discussion, from our problems that we discussed to how they are being helpful, they have proved that it is definitely the need of the hour. And in women's health, I think health is the most important thing, with women passing through different phases of different aspects of life. And on Women's Day, Gujarat IAP and IAP WC Gujarat branch hosting this particular webinar to help with the health of the women is a wonderful initiative, and the initiative of IAP and IAPWC to empower physiotherapists in helping to better ourselves shows their commitment towards excellence. So I thank all the management in IAP and IAPWC who have helped with this initiative of us, with all the authors who have helped in putting together these CPGs. Nearly 40 authors across the country have put in their time and effort in addition to their regular work. So they have put in that effort to bring together these guidelines, and of course the publishing of these, everyone is waiting to see how we can implement these. So now I think we are, and what a gift for all of us on the Women's Day. That I am really happy about this, and we are now open for the questions if anyone has any questions. I do see some messages in the chat box.
I would also like to thank actually Dr. Ruchi ma'am, because I don't think this would have happened without her vision. And you, Madhuri ma'am, get the CPGs into IAP.
Thank you so much, ma'am. It's everybody's effort, and Ruchi ma'am's support definitely is the one which took us all forward, bringing us all together and taking us all walk in one line. And Gujarat branch hosting this, Nehal ma'am supporting with this initiative to disseminate and spread the awareness of CPGs. Thanks for all of you. And any questions anyone has, please, I think you can raise your hand, and then we can allow you to speak, or type your question in the chat box. If you do not have any questions as of now, please, you can post your questions to any of us in any of the IAP or IAPWC WhatsApp groups, or you can email to any of us, and you will be, everyone will be getting an update of these CPGs when they are published and when they're available. They're already published, but then when they're available for everybody. So thank you all. Thank you all the panelists for taking your time, and thank you all the authors for putting this wonderful CPGs together, and thank you Gujarat team for taking this wonderful initiative. Thank you all.
Thank you. Thank you all panelists.
Thank you so much.
Gujarat IAP, and thank you all participants also for giving your valuable time.
Yeah, thank you, especially to Ruchi ma'am. Hats off to her. I can see her in all events, and such dynamism, a true role model to be followed.
True, very true.
Thank you.
Thank you.
Thank you, ma'am.
Thank you. Have a good